and he never heard from her again. Matt began to have experiences like that with more and more patients, and eventually got to where he was having experiences like that with the majority of his patients. And I said to him, Matt, I think you've become one of the greatest therapists in the world. And I said, what's your secret? How did you do this? And he said, well, I had the greatest teacher in the world. And who is that? Who's the greatest teacher in the world? The patients. That's right. He says, I've never had a patient. See, I started him on this when he was a medical student. He's never had a patient without the before and end of session measures. He says, I just feel like I'm cheating, because when I'm not doing well, I find out instantly, and then I just go in a whole radically different direction the next week. And when I'm doing well, I just keep doing more of the same. Now, I don't want you to get angry with me. You can't do this with all patients with borderline personality disorder, or all patients, period. But we began to see this radical change in the speed of treatment. And more the people that I was supervising and working with are beginning to see this in their clinical work. And it's truly amazing. And we feel that it's not just the measurement. You've got to have the techniques to go along with it. But without the measurement, the techniques aren't going to be that valuable, because it's like driving a Ferrari with your eyes closed. You'll run into a wall. You've got to have that information. And so that's pretty much it. And let me just ask you a question, and then I've got a T here from my good colleague, which means shut up, David. But I'll just ask you two questions. Number one, how many of you require your patients to take at least one assessment between every session as a minimal requirement for treatment? Let's see, there's one or two of you. And now this next question is, how many of you, if you had pneumonia, would go to an internal medicine doctor who didn't believe in the use of the X-ray, the thermometer, the blood test, that type of thing? How many of you would go to that doctor? I see no hands. So we have a kind of a double standard. When we're the patient, we demand the scientific method, measurement. But when we're the doctor, we're kind of flying by the seat of our pants. I think in the old days, before good assessment instruments were available, it was understandable. I think in this modern era, when we have wonderful new assessment instruments, I think you can do yourself a favor and your patients a favor as well if you begin to incorporate this into your practice. But I must warn you, it takes courage, because a lot of the times the information you're going to find is going to be shocking to you, kind of embarrassing to you, and not at all what you expected. So again, it has to do